Hello, I'm Cam Patterson, Chancellor of UAMS. Today, the UAMS Fay W. Bozeman College of Public Health is releasing new 15-day projections of the effects of COVID-19 in Arkansas. These projections, like those released in the past, are based on current data provided by the Arkansas Department of Health. Like weather forecasts, these projections are dependent on conditions remaining the same. Today's report predicts continued increases in the number of daily cases, hospitalizations, and deaths due to COVID-19. The models are forecasting Arkansas will have about 94,681 cumulative cases by October 19th. Most cases will be in adults aged 35 to 59. Young adults 18 to 34 years of age will have the second highest number of cases. The models are forecasting that there will be 6,542 cumulative hospitalizations, 2,213 patients needing intensive care, and 1,674 cumulative deaths by October 19. Most hospitalizations will be in adults ages 35 to 59. Long-term projections suggest the pandemic will peak in early March of 2021 at 52,000 active infections. All counties in Arkansas have reported new COVID-19 cases over the last 2 weeks. 5 counties reported 2-week rates of change in positive cases of greater than 100%, and 2 counties, Scott and Logan, had rates of change greater than 300%. 35 of the 75 Arkansas counties had no change or negative change rates. This suggests growth in cases in these counties may be slowing. Now I invite Dr. Mark Williams, Dean of the College of Public Health, to provide more details of the most recent projections.
Thank you, Chancellor Patterson. Hello, everyone. Thank you for joining us again for the Arkansas COVID-19 Pandemic Report. Today I'm going to present the 15-day forecast for cases, hospitalizations, and deaths from COVID-19 in the state. Like always, we will look at the long-term projections. And finally, I want to present some new data from our statewide poll that will tell us a little about what Arkansans believe about the pandemic and how it is having an impact on food and income insecurity in the state. As usual, I begin with the 15-day forecast of daily COVID-19 hospitalizations and deaths. As shown on this slide, COVID-19 cases in the state continue with little change in growth since July. The model is forecasting continued growth in the cases over the next 15 days, forecasting 94,681 cumulative COVID-19 cases by October 19, an increase of 10,983 cases over the actual cases on October 5. We will continue to see growth in hospitalizations and deaths from COVID-19. The 15-day model is forecasting there will be 6,542 cumulative hospitalizations in Arkansas by the 19th, an increase of 737 hospitalizations. The model is also forecasting 2,213 COVID intensive care patients, an increase of 11% over that on October 5. Finally, the 15-day model is forecasting 1,674 cumulative deaths due to COVID-19 disease by October 19, an increase of 322 deaths or 24% over actual deaths on October 5. As I've shown over several reports, COVID-19 infections vary by age. As shown on this slide, the age group with the highest number of COVID-19 cases continues to be adults 35 to 59. The 15-day model forecasts this age group will have 33,964 cumulative cases. The next largest group is young adults between 18 and 34. This group will have 31,696 cumulative cases by October 19. The group with the smallest number of cumulative cases in Arkansas is adults over 75. The 15-day model is forecasting 6,666 cumulative cases among adults older than 65. We also forecast hospitalizations by age. The group with the highest number of hospitalizations is between 35 and 59, who are forecast to have 2,144 cumulative hospitalizations by October 19th. The hospitalization rate of adults 35 to 59 is 6% of those who are infected with COVID-19. When we look at the second highest group of adults who are hospitalized with COVID-19, adults 60 to 74, we find 18% of these adults who have been infected will end up in the hospital, even though they've comparatively modest numbers of infections compared to adults 35 to 59. The same is also true for adults 75 and older, with about a quarter of infected adults 75 and older being hospitalized. I'll come back to those numbers when I sum up. As always, we're interested in how COVID-19 is affecting counties in Arkansas. Counties with positive rate changes greater than 50% are shown in red on this map. 5 counties showing up in our last report also showed up in this report. For the current report, we identified 5 counties with positive rate changes over 100%. 2 had change rates greater than 300%. 35 of the 75 counties in Arkansas had no change or negative change rates. This suggests growth in cases in these counties may be slowing. This does not mean that transmission of the virus in these counties has stopped, just that the growth in transmission has slowed. As we look at the relative change maps over time, we get a sense of the dynamics of the pandemic in Arkansas. High growth in urban areas has tended to be followed by high growth in rural areas, almost in a random pattern. High growth rates tend to pop up, almost like a whack-a-mole game. What this is suggesting is that pop-up growth in transmission may be strongly related to events or places, but not geography. It also strongly suggests residents in counties not currently experiencing significant growth should not be complacent. Rapid growth can follow quickly. This is a slide with which I am sure you are all becoming quite familiar, the long-term projection of the pandemic in Arkansas. The latest projection places the pandemic's peak on March 5, with around 52,000 active infections. The ESER model is projecting that 1,250 people will be hospitalized with COVID-19, of whom 437 will require intensive care. The model is also projecting 152 patients will be on ventilators on March 5, of whom 53 will likely succumb. As I said last time, if a rubber band had a peak point, it would be a good visual model of the pandemic. The size of the rubber band is the number of people who can be infected and changes relatively slowly over time. In Arkansas, there are still approximately 3 million people the virus could infect. As the number of daily active infections goes down over time, the rubber band begins to stretch out, reflecting an extended pandemic with fewer active infections on any given day. The Fay W. Bozeman College of Public Health has been conducting a random digit dial telephone poll to collect information about Arkansans' attitudes, beliefs, and behaviors related to the COVID-19 pandemic. This week, the college looked at several topics. One assessment we made using poll data is, do Arkansans believe they will be infected by coronavirus? This slide shows those beliefs by race, ethnicity, and age. 5% more Hispanics than whites believe they had a high chance of being infected with COVID-19. And more than a quarter of adults younger than 60 said they had a high chance of becoming infected, compared to less than 20% of adults over 60. Data by months show that beliefs about the chances of becoming infected have changed little since May. No more than 26% of Arkansans at any point in time said they had a high chance of being infected with COVID-19. Poll respondents were asked if they believed wearing a mask helps stop the spread of COVID-19 virus. We included this question in the poll on September 5th, so we cannot look at this item over time. The charts on this slide show beliefs about the effectiveness of face masks varies by race and ethnicity. Blacks and Hispanics were more likely to say face masks are effective than were whites. Respondents older than 60 were more than twice as likely to say face masks are effective compared to respondents under 60. We asked poll respondents about food and income insecurity. Food insecurity is an indicator of hunger in Arkansas. We asked participants if they had enough money to buy the food their family needs in the past 2 weeks. This slide shows the vast majority of Arkansans said they had had enough money to buy food. Even so, there were differences by race ethnicity. Almost 20% of Hispanics and more than 10% of blacks said they did not have enough money to buy food. There were almost 600 people who responded to the poll who said that they did not have enough money for food in the last 2 weeks. Of these, nearly 1 in 3 said they or their families went without food as a result. To get a sense of financial insecurity, we asked respondents if they were worried about paying their mortgage or their rent in the past 2 weeks. This slide shows 28% of Hispanics and 18% of blacks said they were worried about paying rent or their mortgage. Also, 14% of adults younger than 60 said that they were worried about paying their rent or mortgage. Finally, the poll asked respondents if they were worried about losing their job in the next 14 days. As shown on this slide, there are large differences in worrying about losing a job by race ethnicity. More than 4 times as many Hispanics and twice as many blacks compared to whites said that they were worried they might lose their jobs in the next 2 weeks. This is the college's report for this time. There are 2 takeaway points. First, the pandemic is not affecting everyone equally. We can see this from the relative change maps and the result about food and financial insecurity. The racial ethnic disparities we have seen in other aspects of social life are very apparent when we look at COVID-19. Second, approximately 1/5 of adults older than 60 who are diagnosed with the virus are likely to become hospitalized. As we begin the family holiday season, when younger and older family members begin to gather in the same place, this is a reason for concern. This is one reason the growth in infections among younger adults is so worrisome. As the generations begin to mix at the holidays, the potential for higher numbers of infections and hospitalizations among seniors older than 60 are likely to increase. This is all we have for today. See you next time.